will discuss the management of crossbite. Crossbite is defined as a malpost of a tooth, buccally or lingually, to the opposing tooth or teeth. So it can be an anterior crossbite or posterior crossbite. It can be single-toothed like this, or multiple teeth like this. There are three types of crossbite. The dental crossbite, when it is confined to the dentition, like this one. The skeletal crossbite, it involves skeletal structures of the maxilla and mandibular arches, where they have, whether if the maxillary is retrognathism or the mandible is prognathism. This means the relationship of class 3 malocclusion, like this one. The functional crossbite, it is called the pseudo class 3 malocclusion, where it is present due to the occlusal interface or premature loss of the deciduous molars, and the patient tends to habitually move the mandible forward to achieve the maximum intercuspation. So it is a functional crossbite. Okay, now how can we deal with it? We will divide the treatment according to the place, which means that we will correct first the anterior crossbite, then we will know how to manage the posterior ones. For the anterior crossbite, if we are still in the developmental stage, we can use a simple procedure, that is the tongue plate therapy. This is it. It is indicated when the patient is still in the developing phase. So they place the wooden tongue plane behind the tooth and they exert a force biting on it for 5 to 10 minutes. After repeating it for several of weeks, the tooth will erupt into the normal position over a period of time. Crossbites can be treated using the Z-spring in a removable appliance. When activated, it will do tipping movement to the tooth. An expansion screw of the can be added to expand the anterior region here. Orthopedic appliances like the face mask can be used to enhance the growth of the maxilla and treat the anterior crossbite by increasing the growth of the maxilla. The chin cup can be used also to decrease the successive mandibular growth. Therefore, it can prevent or correct the anterior crossbite that is caused by the excessive mandibular growth, which means we are talking about the class 3 malocclusion. The Frankel appliance can be used also to correct the developing class 3 skeletal jaw relationship with the anterior crossbite. We can treat the crossbite using expansion appliances like this one that is called the coffin spring appliance, where we have an omega spring, an omega shaped wire at the middle of the two acrylic bases. When it is activated from here, a slow expansion occurs that is bilateral and symmetrical. Another appliance is the quad helix appliance that can be removable or fixed. When also activated from these helices, it will cause expansion that is slow considerably. Crossed elastics can be used to correct a segmental posterior teeth crossbite that the elastic is stretched from the palatal surface of maxillary posterior teeth to the buccal surface of the mandibular teeth by causing a buccal movement of the maxillary posterior teeth and a lingual movement of the mandibular teeth. If you want to sum things up, we have crossbite whether it is anterior or posterior. In the anterior crossbite, if you are still in the developing stage of growth, we can use the tongue blade therapy. After that, we can use the Z spring for posterior bite planes. We can use the expansion removable appliances that we can use also some fixed appliances to correct the anterior crossbite. For the posterior crossbite, if we have a single tooth, we can use the cross elastics and we can use a removable orthodontic appliance with an expansion screw. If we have a unilateral posterior crossbite, we can use a unilateral screw in a removable appliance, or we can use a fixed appliance also. The bilateral posterior crossbite can be fixed by using expansion appliances. The first two are slow expansion appliances that are removable and can be fixed, and the Hyrix is a fast expansion appliance. The expansion is symmetrical, so it is a symmetrical expansion. That's it.